Welcome friends. In this video I will talk on different types of cannula. First of all, what is cannula? Cannula is a small flexible tube which actually surrounds the surface of the needle and extend the effective length of the needle so that it will be easier to give injection in the vein. Now this is composed of PTFE, that means polytetrafluoroethylene, which is also known as Teflon. It is a kind of polymer or plastic, but this plastic is very much resistant to the high temperature and has a long shelf life. Now why this is used? It is used mainly to give fluids in the body or to give blood to the patient. Okay. Now there is different types of cannula available, like peripheral cannula, central line cannula and midline cannula, and their size ranges from 14 gauge to 26 gauge. Now if you see, this is the different sizes of cannula starting from 14 gauge to 26 gauge. Now this is known as cap. So this cap is a particular color. In case of 14G, this color is orange. In case of 16G, this color is grey. In case of 17G, it is white. In case of 18G, it is green. In case of 20G, it is pink. In case of 22G, it is blue. In case of 24G, it is yellow. And in case of 26G, it is purple. Now, how to remember easily? To remember easily, you have to consider there is a rose tree in a orange top, and there is a sky, and in the sky there is a yellow sun. So starting from the orange top, that is 14G, then there is a soil in the top, that is grey color soil, so that is 16G. Then in the air nothing is there, so this is white color considered to be 17G. Then the leaf of the tree is green color, that is 18G. Then color of the flower is pink, that is 20G. Then color of the sky is blue, that is 22G. And then color of the sun is yellow, that is 24G. And above this there is 26G, but nowadays 26G is not used so much, so that's why no need to remember. Now if you see the different size of cannula, 14G to 26G, this diameter, length and flow rate property is actually varies. Now when the size is increased, actually the diameter, length as well as flow rate is decreased gradually. Okay, so if you want to see this table is given here, but when you will be working with the cannula, at the back side of the packet this diameter, length as well as flow rate is mentioned, and this flow rate is actually varies from company to company. Now there are three types of cannula, as I have mentioned: peripheral cannula, central IV cannula and midline catheter. So when and in what purpose these cannula are used? When the period is very short, that is up to 4 days, peripheral cannula is used. When the duration of treatment is more than 1 month, central IV cannula is used. And when intermediate, that means between 5 days to 30 days, this midline catheter is used. Now at what region this cannula is actually pushed or adjusted? In case of peripheral cannula, it is in the periphery, that means on the extremity, on the hand or like that. Central line cannula is actually inserted in neck or below collarbone or in the leg. In case of neck, it is jugular vein, or in case of collarbone, it is subclavian vein, and in case of leg, this is femoral vein. In case of midline catheter, the portion where the catheter is inserted is upper part of the arm. Okay. Now what is the use? If you see, peripheral cannula is actually used for surgical patient to administer drug. This IV cannula for central line is used for giving blood and fluid in large quantity, and midline cannula is used for taking blood from the body. If you see midline catheter, it looks like this. You see there is two channel, you see 1 and 2, okay, and central line cannula has 3 channel, 1, 2 and 3, okay. And you see the peripheral cannula at the extremity, that is the hand, you see this portion, and this is midline catheter, that is the arm, middle portion of the arm. Now central line cannula, below the collarbone, that is subclavian vein, and the leg, that is common femoral vein, this one. Thank you.